at scapula because it's very important. Tends to be very, very tight. Most of us, by the end of a stressful week, our shoulders are growing out of our earlobes. We've elevated quite a bit, and we need to work on getting those shoulders back down. So if we're going to stretch an upper tract, so we did manual muscle test side bend. We said that was because that's controlled a lot by the upper tract of the shoulder, but we're going to stretch it a lot with cervical issues. So if we're going to stretch our right upper tract, say I'm tight and I'm tense and my right shoulder's elevated, I want to lower that right shoulder down, and I want to tip my head in the opposite direction. As you found out when you were measuring with your goniometers or your tape measures, as a person is laterally flexing their head to one side, so say to the left, if they're tight in their upper tract, their arm is going to follow. Well, that negates our stretch. So before you have someone tip their head, you may have them tuck their hand behind their back. If they're sitting down, so if you're sitting on a chair, if you're sitting on the side of the table, you can have someone hold on to the table. You can have them sit on their hand, but something perhaps to stabilize the side that you are stretching. All right, so if you stabilize the right side, get a nice tall posture, shoulders back, and now again, I'm telling my patients here, keep your eyes forward, you're not rotating at all, you're just going to tip your head to the opposite side. You should feel a nice stretch, so everybody do that. We'll do both sides because we all probably need it all. All right, so nice stretch. So we're just using the weight of the head. If someone is weak, if someone is tense, if someone is flared up, typically we don't need any extra pull. Just the weight of the head will do the job. If you do need a little extra pull, Tiffany's already doing it there, you can reach up with your left hand and give yourself a little bit of pressure, a little bit of overpressure. We don't want to inflame anything. If there are nerves that are angry, we don't want to pull on them. So that may be a progression later. So just start with tipping the head to the side and holding whatever the patient will tolerate. I like 30 seconds and above, but maybe they can only do 10 or 15. And then rest the head, rest the shoulder. Okay, let's do the other side, just for balance. So left arm is tucked behind my back or under my backside or holding onto the chair. Drop my right earlobe towards my right shoulder. I'm stretching my left upper tract. Do these all day long.
Feel it up in here.
Okay?
Is that weird?
It's not weird, not uncommon. There's fascia that comes all the way up. Oftentimes, in certain areas, we will get a little myofascial tightness. People who have headaches, you were nodding and raising your hand about migraines and such earlier. Oftentimes, we'll do even grabbing someone's hair and moving the scalp around just to work some of that fascia. So you probably have some myofascial tightness in there as well. So it extends beyond the muscles into the fascia. Okay? So upper tract stretch. We're just going to tip the head the opposite direction of the upper tract that we're stretching. The next one on here, we've got the levator scapula. Again, this is a scapular muscle, but it attaches up at the head. And this one's going to cause a lot of tightness in the posterior cervical region. So if you think of running from the occiput straight down to your scapula, it helps lift the scapula. This one gets tight a lot as well. We're going to stretch very much the same way, except this time we're going to stabilize. We're going to tip the head away, but we're also going to add some flexion. So you want to tip the head forward. So we're going away and then forward. We're looking down. Now you should feel that stretch move around to the posterior side of the neck because we've added that flexion. I like this one. And again, if we need to add a little bit more, we can. So we're flexing away, we're rotating away, and then we're laterally flexing away, rotating away, and looking down. So I oftentimes will tell people, look down towards your opposite underarm or to your opposite foot. Okay, let's do the other side. So hand behind your back, laterally flex away, rotate away. Uh-oh, this one's tighter on me. this will often tighten up upper trap and levator depending on how you sleep. I am someone with neck issues, and if I roll over in the prone at all during the night for more than a minute, I can tell the next morning my neck is unhappy. And that's the position that I used to sleep in all the time. And now I cannot, because I can really feel it. Okay? So levator scapula stretching. Sternocleidomastoid stretch. All right, so you manual muscle tested, so you remember that the sternocleidomastoid rotates the opposite direction. So on here, if we're going to stretch an SCM, we are going to side bend away. We're going to rotate the same direction of the one that we're stretching, so we're doing right, and then we're going to extend. And then you should really feel it in that SCM. Now, again, keep in mind, we're not necessarily isolating all of these muscles. We're still going to get stretch in other surrounding musculature that maybe perform similar duties. All right, so if we're going to stretch the left SCM, we're going to side bend to the right. We're going to rotate to the left, same direction, and then extend the head back. Oh, yeah. This one you don't necessarily have to tuck the hand. You may add a little bit more stretch by tucking the hand behind, but you're typically not going to have as much movement through the clavicle as you do with the scapula with the other muscles, but you can tuck the hand behind if you want to accentuate that stretch just a little. Okay?
Is it normal to hear bones crack after that?
Yeah, well, after I manual muscle tested you, of course. Of course. And you may have some, quite honestly, you may have a lot of people that will have some popping and those inadvertent capitations. You may have patients that, you know, the ones who do this all the time. All right, so pal stretching. This is one of my favorites. So I mentioned when we were doing our palpation that your first rib is right underneath your clavicle here, your scalene's attached, and your scalenes will often be tight, and they will lift and elevate that first rib too much. So what I'd like for you to do is take your pillowcases here. You can do this with a towel, you can do it with a pillowcase, just something long enough that you can get it around your neck. So self-mobilization with movement or mobilizing the first rib. So we've got a couple of things we can do here. We can hold on to our neck. We can stabilize as we're stretching. If someone is tender or they feel a little timid, a little nervous about moving, you can have them just hold on to this as they do some of their stretching, and that gives them a little sense of comfort because they have something around their neck. So just keep that in mind as something that you can easily do. And then we can also add extra stretch. So if you're going to stretch your right SCN, you're going to stretch your right scalenes, you're going to try to mobilize the first rib on the right, what you can do is tuck one end under your left underarm. And now take your left hand and grab the towel so that it should be tucked behind. So we're going to mess behind. Yeah, there you go. So you're making a loop. You're basically making a diagonal loop. Now I can tilt away and start with my upper trap stretch. And then I can give just a little downward pressure with my left hand. And can you feel how instead of giving pressure to your head, it's giving pressure directly at that first rib? It's holding it down. I really like this one. Really like it. Okay, so the key is you're pulling with the opposite hand so you get that diagonal pull. So you can rotate your head forward slightly, deflection, and get a little bit of that levator scapula. You can get some of the SCM, but if you just tip your head away, give yourself some pressure, you're going to self-mobilize that first rib underneath the towel. So that little gentle pull down, you're pushing that first rib back down where it needs to be, instead of letting the scalenes lift it up. So just for symmetry, let's switch sides. So now we're going to tuck. Now we're going to tuck underneath the right underarm. We're going to pull with the right hand. or something with some padding wrapped around it. You want it to be padded enough that it's not aggravating for the patient. I've also seen some therapists use a sheet and have the patient stand on it with their opposite foot. So instead of being tucked underneath their arm, they're standing on one end and pulling with that same hand. So these are manual techniques that we may use our hands to perform with the patient, and then we can send them away to do this at home by using a towel or a belt or something like that, so they can continue working on that. Because think about at the end of the day, if everything is elevated here, it's really hard to get everything to release, lower back down to where it's supposed to be, and sometimes you need that extra pressure. And your patients aren't necessarily trained with their hands, and you can't really relax and poke yourself and make yourself relax at the same time. It's really hard to endanger yourself. It's really hard to inflict pain on yourself when something is hurting. So these are easy ways that we can have patients do that. All right, suboccipital. Oh yeah, this is the reason why I wanted to do this section. So when you were working with your patients doing palpation earlier, you were doing a little suboccipital release just with the fingertips on your patient's suboccipitals. Again, we want to send patients home with ways that they can do this. This is 2 tennis balls taped together. We're going to put these directly at our occiput. Because the tennis balls are round and they're next to each other, that gives us a nice little trough here where the spinous processes can sit and not be aggravated. Okay, so I can lie down. I'll go this direction. I can lie down and put this under my head. Move my hair a bit here. It's not directly under my neck. I'm not lying here with this just filling the space under my neck. I'm lifting this up so it's under my occiput. This just gives a nice pressure. The way the shape of the tennis balls are right underneath my head. And this gives me a nice pressure. It also puts me in a correct chin tuck position, you see. So this is helping to work on posture. It's releasing. Remember when we talked about the forward head posture at the beginning of lab? That we get stretched out and loose and weak on the anterior cervical flexors. And we get tense, tight, and weak because we're so shortened at the cervical extensors, the way our head lifts up so we can see. This helps to relieve that. So you can tape 2 balls together, you can put them in a tube sock, so put 2 balls in and tie the tube sock. This works really well. If someone's not able to lie down, you can have them lean up against a wall with this. It's not quite as effective because they're not able to unweight the head, but this is very, very nice. This is a good release for people who have very severely tense neck muscles, headaches. Often this tension right up here at the top of the neck is detrimental to people at the end of the workday. They just can't take it anymore. So I will oftentimes have folks take one of these to work. So in your times of stress, during your little break, during your lunch, all right, I'm going to close my office door. I'm going to go into the break room. I'm going to go find a nice little place where I can lie down on this. Okay, these are fantastic. Very cheap home fix. We like those. All right, and then we also talked about contract relax. Okay, so you practice that just a little bit. So especially with rotation and with side bend, I'd say rotation, I use it most of the time. Oftentimes your patients are going to come in and say, I can't look over my shoulder when I'm driving to see traffic. Or I can look this way and I can't look this way. And when you test the range of motion, even just looking at them, if you have them look one direction, look the other direction, you can see a marked difference. You lie them down, get them comfortable, have them practice some range of motion, you do whatever work you need to do on them. There's still a little discrepancy. All right, we're going to do some contract relax. And you can see a huge gain. And oftentimes people can get pretty even just with doing a couple of rounds of contract relax. Again, this is something that a patient can do at home. So you give them a home exercise program, they work on rotation. Yeah, I'm still having trouble going to the right. Okay, put your own hand up here, give yourself a little bit of pressure. Put your hand up here, give yourself a little bit of pressure, whichever direction you're going. You can teach them to do some self-contract relax. Do you have a question, Ashley?
Yeah, does the contract relax, does that only increase the range of motion like while you're actually doing the specific stretch, or after you do it and then you consistently like, does my question make sense? Like,
Yes,
does it?
that's a great
Okay.
question. That's a great clinical thinking question. So just like with our other stretches as well, once we gain some new range of motion, we have to move into it or we will lose it.
Okay.
And once you do contract relax on someone, they're not necessarily going to come back the next session and have all that new range of motion that you gained. But if you use that motion, so you've stretched them, they've gotten 45 to 65 degrees of motion, and they get up and they go on about their business, they will easily go back to where they started. But if you then have them work into motion, so I'm going to have them do some range of motion exercises, I'm going to have them reset those Golgi tendons. Remember, they're going to tell you, oh, don't go, don't go, don't go. I can reset them by having the patient do exercises into that new range, prescribe the patient some self-muscle energy or some self-contract relax every day, and then they will maintain most of those gains, if not all of them. Okay, so that's our goal. But if the patient goes back to the aggravating behaviors and activities, they'll probably lose some of that ground, but we should be able to make a dent. But always, with any of your stretching, remember, if we stretch someone, they self-stretch, they gain range of motion. You need to then work into that new range of motion.
Yeah.
Okay? Great question. I like that. All right, so that's some good cervical stretching.